Hi, welcome to the Health Corner here on the Breakfast Show on Camnet TV. I am Dr. Nakuya Namfaya. This week we are talking about hypertensive heart disease, and yesterday we were talking about some of the signs and symptoms of hypertensive heart disease. We say that some symptoms of hypertensive heart disease include chest pain, palpitations, or abnormal heart rhythm, and also swelling in the legs and back pain. So today we are going to talk about how is it diagnosed and also how is it treated in the hospital. So for people who have hypertension, and you already know that you have hypertension, most of the times you'll be told if you have any other symptoms like chest pain, you might be told to do certain tests that can show to check if you have a problem with the heart. And these include things like echocardiogram, which is a scan for the heart to check whether the heart is functioning well, or if it's not functioning well, then you most likely have hypertensive heart disease. So the other test that can be done to show whether your heart is functioning well is an ECG, which can show whether the heart is really pumping blood well or not. So the other tests too that need to be done to check if the other organs of the body are functioning well, like the kidneys, the liver, and just the blood itself. How well is it? Is your HB okay? And are there any other signs of infection in the body? So these are some of the tests that can be done at the hospital. Then for the management of hypertensive heart disease, usually the goal of management is for you to be able to control your blood pressure. So you need to be on medication that helps to control the blood pressure, because that is the whole cause of the heart disease. So you need to control the blood pressure. So you'll be given medications that help to control blood pressure, and these medications are different and they vary. So depending on how well your body responds to one medication, you might be put on that medication or you might be changed to another medication depending on how well your body responds to it. So it's important that you get medications that have been prescribed to you from the hospital to be able to control the blood pressure. Also, it's important that you take your medications every day as prescribed, because this will help in the long run to prevent you from having further damage to the heart and also further damage to other body organs as well. So the other thing that needs to be controlled when you have hypertensive heart disease is cholesterol. So if your cholesterol is not controlled by your diet and you're taking in so much foods that have got high cholesterol or high in saturated fats, you might be put on certain medications that help to control your cholesterol. So it's very important that you take these medications as well. The other thing is that you might be given medications that help to prevent your blood from clotting, because when the blood clots for too long or too much, it can lead to having blockages in the heart. And when there are blockages in the heart, they might cause a myocardial infarction, which is a heart attack, and so many other heart complications that may arise from having blockages. So you might be put on medications as well that help to prevent blood from clotting too much, or to prevent the blood from clotting. So these are some of the medications that needs to be given in the hospital for you to be able to manage or treat the blood pressure or the hypertensive heart disease. So there are other things as well that you can do at home for you to be able to manage this condition well, and we'll talk about the lifestyle modifications that you need to do at home for you to be able to manage the hypertension and also prevent yourself from having hypertensive heart disease, or if you already have hypertensive heart disease, to be able to reduce the symptoms or the progression of this disease. So tomorrow we'll talk about how you can live a healthier lifestyle to prevent yourself from having these complications and also prevent these complications. And if you do not have hypertension or you do not have hypertensive heart disease, then you can still implement these lifestyle changes to be able to prevent yourself from having hypertension and so many other lifestyle diseases as well. So today we are learning that hypertensive heart disease can be treated in the hospital with some medications that are given, mostly to reduce the blood pressure and to keep the blood pressure under control. And also to reduce the cholesterol if you have high cholesterol in the body, and to prevent blood from clotting, because as the blood clots, it can lead to blockages in certain parts of the blood vessels, especially the vessels of the heart. So this has been the topic for today. I do hope you have learned something. If you haven't learned anything, make sure you get this, that you need to take your blood pressure medications, because it's important to prevent yourself from having so many complications, including hypertensive heart disease. Thank you so much for watching.